All right. So for this checkoff, I'm doing the oral medication, and I have my doctor's orders, and I've already transcribed everything, the medication that they're going to be taking, and I've also done the calculations to convert them beforehand. Sorry, beforehand. That way, I won't take up too much time. And then I also have my medication notes here. So for this patient, their condition is stable. They came in for congestive heart failure, fever, and the medications that I need to give are furosemide, dioxin, acetaminophen, and potassium chloride. So the first thing that I would do is make sure that everything is good on here, and everything is transcribed correctly. And then you'd go into the medicine room and get the medications you need. Obviously, when you put in your code or your password, whatever it is that they give you, you put it in. You take one medication out one at a time, and also make sure that the medication is not expired and that it's the right dosage. So that's your first check, and then after you do that check, obviously you want to make sure that everything is correct. So you put in everything, you calculate your dosages, and I have my medication here, right there. So here's my acetaminophen, potassium chloride, and then I have the dioxin and furosemide. So for the acetaminophen, it would be 10 milligrams. So you would put it on a flat surface, and this one's already labeled for me. I'm sorry, this one right here, because this one's 15. So this one, the 10 milligrams is right there. Put it right here. And then you cover the label with your hand so that way nothing gets on the label. So that's acetaminophen. And I have a Post-it so I could write what it is. Right there. And the potassium, 15 milligrams, cover the label. And for the dioxin, it'd be half a tab. So we would cut it. I don't have a pill cutter, so we'll just assume he takes only half. And this is a 20 milligram tablet. So after I do all this, I would put it on a tray and then head to the room. So here's my patient. I knock on the door, I wash my hands, and I introduce myself. So my name is Lisa, I'm a student with EPCC, and I'm here to give you your morning medications. Can you confirm your name and date of birth?
My name is Amma Hurton.
And your date of birth?
268691.
Okay, assuming that's correct. I would also check his label to make sure that, his wristband, to make sure that the wristband coincides with the name and the date of birth. And then I would do my check with them, and I would let them know that I'm doing my very last check so they'll know exactly what I'm going to be giving them. But before I do that, I do need to check their vital signs. So if the potassium, after checking their vital signs, the heart rate with the stethoscope, so I would check it, and if it's over 60, I believe. I would need to give them their medication. And then also for their temperature, which is higher than what is indicated on the physician orders. If it's higher than 101, then we would give them the acetaminophen. And because the heart rate is higher than 60, we would also give the dioxin, and then we'd give the regular medication, the potassium chloride, because they've been constipated for 3 days. So we would do it with this one right here. So I would ask the patient if they have any allergies. Are you allergic to anything?
Yes, I am.
What's the name of the medication?
I believe it's called Torto.
Torto. Okay, so it does match with the physician orders, and it also matches with their name tag, wristband, sorry. So again, I would do my last check, make sure that everything is closed and that the expiration hasn't expired. I asked the patient if they need water with their medication, and if so, I would give them a little bit just to make sure that they can swallow. Being that the patient can swallow correctly, then I know that their gag reflex is good, and I don't have a bed where you could sit it up, but I would sit them up just a little bit. That way they could swallow the pill. I would also ask the patient if he could take it themselves or if they need help with the medication. Can you take the medication?
I can take it myself.
Okay, so then they would put the medication in their mouth, and I would wait, and meanwhile I wait just to make sure that they take the medication. I'll check the next medication that I'm be having them take. So the acetaminophen, that one, I'd make sure that I have the right milligrams, which it is a 10. Assuming he took the medication already. I also forgot to mention, I would also review their blood work to make sure that everything is good, because they are going to need the CBC and the CMP. And then also the next medication, since the patient already drank it would be the potassium chloride, and that one is 15 milligrams. So I would double check that again, which would be my last check. And make sure that the patient takes it, and also do the last one, which is the digoxin, which is half of the pill, but I don't have a pill cutter, so assuming this is half, I would go ahead and give them this one and give them a little water to make sure that they could take it. So that would finish that. I would adjust the bed back to where it was. I would ask the patient if they need anything else from me. I would do my nurse's notes indicating that they took all the medication, that what their heart rate was, their potassium levels, and also their temperature. So everything is right in here, and that way they know what was given to the patient. And I would also put on here everything is correct, so they are allergic to, the patient is allergic to Toradol. And then I would also put here what I gave to the patient in the room. That way they know that, or the next shift knows what medication I gave the patient. So after all that, it also gives me time, while I'm writing that, it gives me time to make sure that the patient is, there's no like reaction to, or bad reaction to the medication that they already took. And after that, I just ask the patient if they need anything else from me. I'd come back and check on them just to make sure that they're feeling okay after taking the medication. Anything else for me?
No, that'd be it. No.
So then I would step out of the, well, before I step out of the room, I'd get alcohol or wash my hands again, and then I would step out of the room.